Okay, so we want to talk about this is the introduction to paramedicine and talking about all the options you have as a paramedic, what we expect from you as a paramedic, and different routes that you can take and expand this on besides just working for the fire department. So, with this, we're going to talk a little bit about the different EMS systems and maybe identify some other job opportunities or other areas you can work as a paramedic besides just what we think of the standard as the ambulance or on the fire department. So, with this, we're going to talk about that integration of everything. What we're expecting you is to know not only the medical knowledge, but safety, well being, medical legal issues, ethical issues, how to be compassionate. And as we're dealing with a paramedic, basically we're talking about the highest trained EMS professional that's out there. And you are to lead the call, be compassionate, be there and be that patient advocate so that you can take not only that education training, but you're compassionate towards those patients, understand their feeling and understand what they're going through. This could be you. So obviously we know the different levels. Again, this is a national course. The EMR, Emergency Medical Responder, this is also kind of our first responder type thing. We're all aware of the EMT, advanced EMT, and then our paramedic as far as our levels. We've gotten rid of the IV tech, airway tech, and that's kind of just gone into the advanced EMT. And this is an ever-changing system as our EMTs are doing more and more medications all the time. So same with as a paramedic, your ability to do more medications and more treatment is going to be there. Now, we're also going to be expanding into that new type of paramedicine where now you're not only working on the ambulance and the fire truck or in offices, but now you're going to be going out into the community. And that's kind of the new scope of where everything is pushing to is community paramedicine. You're not even dealing with the healthcare, you're dealing with public health, and you're dealing with public safety. So all those kind of components, and we mesh into all three of those areas. So under medical direction, you're going to be able to take this out there and go out and see patients, possibly see them at their home and prevent overflow in the ERs. And that's kind of where we're going to function and push to. You're really going to be that connection and almost being the physician's eyes, ears, and hands out in the field. So we're going to train you here to become critical thinking paramedics that the doctors are going to trust and be able to do a ton of different things. Now, of course, with part of being paramedic, we do expect you to be also doing education. That's kind of the thing that we'll do is not only are we going to train you how to become a better paramedic, but we want you to do trainings in your community, in your departments for other people out there. And that's going to be kind of your job. People are going to look at you too. So to be a good paramedic, you have to have all of these characteristics. All going to be very important. And we're going to be following up with you in class to make sure you're hitting that. And then, as of course, with any medic, and we don't want to just recert National Registry, but you need to be continuing education. You get out of class, you use it or you lose it. And there's always new learning opportunities. So we want to see you're continually being involved in your education, your learning and training, as well as the more you're out teaching to the public, as well as to other EMTs in that, it's going to ingrain that knowledge and it's going to make you a better paramedic in general. So, again, here's our introduction. This is a national level of kind of what we're seeing. We are not having you work on a research paper per se, but we are going to have you do a paper. We want you to get on a topic and get into those type of things. Some of the other areas that we're going to be looking at is not only that 911 response, but critical care transports, life flight with helicopters, tactical EMS with the RFT teams, industrial medicine, sports medicine. There's so many different areas. On the critical care transport, I actually worked as a flight medic. You can work for a flight medic at Life Flight. Life Flight. There's lots of different opportunities for you to get into positions for those. You can also work with MedStar. They do have in certain areas their paramedics on their critical care ambulances. So a lot of different opportunities besides just the normal that we think of. With the helicopters, usually we're looking at a nurse and a medic for Life Flight. They're talking about an RT and a nurse for MedStar. But there are other opportunities across the country for this, especially even in Texas. There's a lot of opportunities for double medic helicopters. Um, so if that's kind of your desire to go into, we'll be able to set you up with different job opportunities as well and show you where you can find those opportunities. Tactical EMS, I talked about the RFT teams that we have with Spokane City Fire and Spokane Valley Fire, and they basically work with the police officers for tactical events, hostage situations, mass casualty shootings. You can also work in a primary care setting. There's a lot of paramedics who are working with cardiologists. They are doing the pre-specialized labs. Lots of different things in an office setting that you can be doing as a paramedic as well. As far as the industrial medicine, there are some large companies that will actually hire paramedics as their safety officer. And again, you're working more as a PA almost than a standard of there. So a lot of different opportunities besides the normal EMS and 911 response. So, and we'll show you different places that have this, but there are a lot of different facilities here in Spokane that hire paramedics, including Spokane Cardiology, for a lot of their testing. As far as sports medicine, usually they're looking at PAs, but there are areas that they're hiring paramedics. Some colleges are even doing that. So that's out there. Corrections with the Department of Justice has that. And then, of course, in the hospitals and the emergency departments, there's lots of different roles that come in. Usually they're looking at EMTs, but also hiring medics into the ER setting as well. So a lot of different opportunities that are out there for you to look into. Again, EMS is our main area. That's what we're going to train you on, and that's what we're going to do. But the abilities of where you can go is open up and endless with opportunities. So that's kind of our introduction to kind of the class and what we're going to go with this. So we look forward to getting you through this and helping you in any way and getting you to your end goal.